I'm Gary Null. Nice to have you with us today. We're going to talk about how a high-fat dairy product is linked with a reduced type of type 2 diabetes from Lund University in Sweden. We're also going to look at folic acid helping older people when it's hot outside, and we're going to be there very shortly. Dangers of adolescent energy drinks. We're drinking a lot, and it's bad for one particular organ in the body. We'll discuss that from Research Institute Hospital in Spain. One serving of spinach a day could keep mental decline away for 11 years. And a study finds that each hour spent watching television daily increases the risk of developing diabetes by 3.4%. University of Pittsburgh on that. Always with the latest on health and healing. Now, there was a big study that was done to determine what could be impacting just one of the items, type 2 diabetes, which is an epidemic in the United States. Probably between the pre-diabetic and the diabetic, around 100 million, nearly one-third of the population. Well, what they found was that, and this was published in the American Journal of Clinical Nutrition, that those who ate dairy in the form of a high-fat yogurt had a reduced risk. Quote, those who ate the most high-fat dairy products had a 23% lower risk of developing type 2 diabetes than those who ate the least. Okay, but a high meat consumption was linked to an increased risk of type 2 diabetes, regardless of the fat content of the meat. That's interesting. They studied 27,000 individuals for this particular study. Now, my take on this. A, I don't believe that you have to have any high-fat dairy at all to reduce diabetes, because it is the quality of the fat that makes the difference, because it creates what is known as satiety, where you simply are not as hungry. And the quality of the fat and the probiotics. So if you looked at coconut oil, 1 teaspoon of coconut oil would be more quality fat, but a really healing fat, protective of the brain, turning off inflammation in your brain, helping with the heart, helping with your digestive system. It is just a superstar of fats. So it would do the same thing, because I just finished a major health support group on lifestyle and behavior modification for diabetes and high blood pressure and allergies. And we had one person after the other who came in years on diabetic medications, couldn't keep their blood sugar in check, and by the end they were all off. Their doctors took them off, their insulin medications. Their blood sugar was normal, hence they no longer had a diagnosis of diabetes. In fact, that is being published and submitted for peer review, that particular study. So the quality of the fat. But let's say you didn't want to use coconut oil. You could use hemp seed oil, avocado oil, walnut oil, olive oil, and flaxseed oil, all of which would give you similar benefits. The older you get, the less likely you are to have enough folic acid. And one of the sources of folic acid is dark green leafy vegetables, which a lot of older people don't eat. Now you got to ask why. And when I was doing my research on 3 separate anti-aging documentaries, the feedback that I got was, well, they have dentures, or they have poor gums, and the fiber doesn't suit them well, or they have colitis, or they have intestinal problems, and they get diarrhea or bloating or gas, in which case then don't stop eating those important vegetables. You need them. You need them for calcium. You need them for chlorophyll. Instead, strengthen your gums. Start working on a protocol just for strengthening your intestine, cleaning it, and overcome malabsorption and leaky gut syndrome. Not difficult to do. Glutamine helps to do that, 2,000 to 3,000 milligrams a day, and probiotics, and sauerkraut juice or cabbage juice twice a day, and vitamin C and quercetin, all of which are extremely healing for your intestinal system and digestive system. But folic acid we need. And since you're not going to get it from the vegetables, if you're not eating the vegetables, then take a supplement. My suggestion is you take a methylated 500 micrograms mcg to 1 milligram per day, and that can help, according to Pennsylvania State University. Quote, folic acid supplements can help prevent heat-induced cardiovascular events in elderly people by improving blood vessel dilation. And why is that? This is partly due to older blood vessels that produce less nitric oxide. Now, you've heard me mention nitric oxide. When you drink some beet juice, you get nitric oxide. And by the way, for the men in the audience, if you're having problems with erectile dysfunction, about an hour before wanting to have your intimate relationship with your partner, take an 8-ounce to 12-ounce glass of beet juice. And that provides you with nitric oxide. And that can help sustain an erection. Simple. Without any harmful effects. So, take your folic acid with your B complex, and folic acid increases the bioavailability of what is called BH4, and that is important. It helps the enzymes involved in the whole process to get better circulation. Also, there are a lot of dangers to younger people from drinking those energy drinks. This is from the Research Institute Hospital in Spain. Quote, cardiologists urge physicians and parents and educators to monitor the energy drink consumption. Why? Simple. Because there's a rapid rise in popularity of energy drinks, particularly among people, adolescents 10 to 19. And young adults have serious problems when they drink these with cardiac health. In an article published in the Canadian Journal of Cardiology, a major peer-reviewed journal, researchers focused on the pharmacological aspects of energy drinks and their adverse reactions, and how the marketing of these drinks as a means to relieve fatigue and improve physical and cognitive performance are ignoring the real dangers. And they found that there is about 30% of all 12 to 19-year-olds are consuming these on a regular basis. You're getting caffeine, high fructose corn syrup, and by the way, they can contain masked caffeine in the form of guarana, and that comes from Brazil, a plant, and it's identical to the caffeine found in coffee beans, but it's twice as strong. So when you have the guarana and other substances like that, you end up having uncertain reactions. So don't consume the energy drinks. And one serving of spinach a day could keep mental decline away for 11 years. Now, this was done at the Rush University in Chicago. Researchers found that adults who ate the leafy vegetables suffered considerably less cognitive decline than those who did not. The findings were regardless of other factors such as education, exercise, or family medical history. They analyzed 950 people, and that's what they found, that you need to have your spinach, in part because it's a great source of vitamin K, and vitamin K has really been linked to deficient vitamin K to mental decline in Alzheimer's disease and dementias. But consumption of spinach protects the brain. This was presented at the Experimental Biology Conference in Boston. And finally, a study from the University of Pittsburgh shows that each hour spent watching TV daily increases the risk of developing diabetes by 3.4%. Quote, here's what it says. This was published in the Journal of European Association for the Study of Diabetes. The study on the effects of sedentary or sitting time on diabetes risk by Dr. Wagner, the lead author, and others. And in their new research, they found that sitting, watching television is really bad for you. And it isn't bad for circulation. It's bad for your resting blood sugar. You need to be moving. You need to take walks. You need to exercise. You need to play. You need to do something to get your circulation moving. And they're finding that that makes an enormous difference. So you increase your risk of diabetes if you watch television